good preventive measures, stop smoking. He came again saying that he cannot walk and he cannot use one of his hands. When she took the detailed history, we understood he was getting bullied. Stress can cause anything.
How do you differentiate between a tension headache and a serious headache?
I never had headache in my life, madam. Certainly from last 5 days, it is the worst headache of my life. Now then I am worried. Any symptom which is sudden onset should be first considered as stroke until proven otherwise. From last 10 days, he was having headache and then today morning he collapsed.
Are you afraid of losing work to AI?
Not at all. I feel AI has been now my friend. The doctors who use AI can replace the doctors who do not use AI. They were playing with ChatGPT or Gemini, they wrote something and in the bottom it was written that there can be a chance of tumor. In last 3 months, I got 2 aneurysmal bleeds. Both of them had love for gym. This spiritual life has made me a better doctor than what I would have been. There lies the importance of meditation, relaxation, learning the art of living.
Are doctors losing patients to generative AI? Data suggests that millions of users consult ChatGPT about their health each week. On this episode of Buzz by the Bay, we explore the responsible use of AI in health queries, the psychological toll of excessive online searching, and how stress can mimic serious neurological symptoms. Very pleased to have with us on the show Consultant Neurologist from Wockhardt Hospitals, Mumbai, Dr. Sheetal Goyal.
Thank you for inviting me.
Welcome on Buzz by the Bay. A lot of important things to talk about. But firstly, I just want to mention here that you, of course, are the Consultant Neurologist at Wockhardt Hospitals in Mumbai Central. Also, you're a stroke specialist.
Yes.
And you specialize in memory and movement disorders.
True.
And headache
Yes.
disorders as well.
Yes.
Muscular and headache disorders.
Correct.
So, I want to talk to you about AI and how so many people now consult Dr. ChatGPT. Earlier, it used to be Dr. Google. Abhi to ChatGPT naya doctor hai. I want to talk to you about how, to use AI responsibly, how online searching and catastrophizing has an impact on your mental health. Too much of it, of online searching. Also, when should you really be worried? Like symptoms like headaches, numbness, memory loss, dizziness. When is it just anxiety and when is it symptomatic of a serious neurological disorder? So first off, Doc,
Yes.
are you afraid of losing work to AI?
Not at all. I feel AI has been now my friend.
Okay.
Yes, I am using AI day in, day out, but not for diagnosis, but for keeping myself updated with the recent technology and informations. See, I tell you, AI cannot replace humans, that is doctors, because AI can give you information, but it cannot give you that human touch, that compassion, that empathy, and that understanding to a disease. The doctors who use AI can replace the doctors who do not use AI.
2026 survey in the UK showed that 16% of UK doctors use AI and they feel that their productivity has increased.
Yes.
But data also suggests that 1 in 6 adults is consulting ChatGPT for health queries and they find that 24/7 access, it's free for the most part.
Yes.
Also, some people have said we find it more empathetic than doctors. So what do you feel about that? Because many professions are now worried about losing work to AI.
See, I tell you, one thing is very clear and correct by your statement that AI looks more empathetic. I tell you my personal experience.
Okay.
When I was using AI, the love and care they showered on the sentences they used, I was worried that do our parents also talk with so much of love? I completely agree that will the young generation or coming generation will mistake it to be the actual care and love given by the people surrounding. Secondly, what you have told that do people use AI for diagnosis? Yes, they do. I'll tell you only one sentence on that.
Yes.
That AI has increased the knowledge, but it has decreased the peace of many of the common public.
Peace of mind.
Yes. I have seen people coming in OPD with negligible complaint in actual. But just they were playing with ChatGPT or Gemini, they wrote something and they got a huge differential diagnosis, and in the bottom it was written that there can be a chance of tumor. Not
My
to
God.
Yes, and not to your surprise, I had a patient who flew from Singapore to me, the couple.
Okay.
And the wife, when she consulted me over phone from Singapore, she said, "Madam, I need to treat my multiple sclerosis and I'm going to come for that." And I appointed her and I just gave her timing and all. And when she came, I said, "Okay, show me. Where is your multiple sclerosis? Where is your MRI?" And then they said, "No." I asked ChatGPT, and the ChatGPT said, "You have a high possibility of multiple sclerosis."
Oh my God.
Yes.
And she
And-
flew from Singapore.
Yes, and they were planning for intra IVF, and they stopped that plan of IVF. They thought, okay, first my wife will get treated for multiple sclerosis, and I tell you, I have to do MRI to prove them that they were wrong.
Oh my God. So this
Yes.
is the problem with the
Yes.
lay person, a non-medical person
Yes.
like me, using ChatGPT or Gemini or whatever the app, the generative AI app is, chatbot is, for diagnosis.
I tell you, I have many young boys. I don't know, less of the girls, but majority of the young boys, all good, fit and fine. They come to me with non-specific neurological symptoms, so much anxious, and they speak certain medical terms which I also don't use to my common patients.
Okay.
And I say, "From where did you read all this? How do you know at all about all these terms?" And they say, "No, no, madam, we have gone through this all AI, and I got to know that I completely feel I have this issue. I completely feel I have this issue." Now, this is happening. Now, why? I'll tell you, because they are the words that AI use is so lucrative, like it makes you feel that he is right and the other person must be wrong.
It's very convincing.
It's very convincing.
So what is your advice to patients?
See, I tell you, AI is not bad. Use AI, but only for information. See, AI give you a generalized information. It doesn't give you your individual answer.
Yes.
So you can go through it, not bad. But having half knowledge will increase your anxiety more, and actually you're not, from what you're actually suffering, you'll suffer more than that because of psychological problems that you will develop.
Okay, so you will
Yeah.
suffer more, you'll cause
Yeah.
more stress and anxiety to yourself.
Yes. And I tell you, there is something known as prompt engineering. I am sure you know about it. Means to get a correct answer, you should also know what you are supposed to ask.
Right.
Sometimes what happens when patient comes to my OPD, I keep asking them leading questions to nullify some of the diagnosis. Now they don't even know what leading questions they have to put in ChatGPT.
Absolutely.
You should also not feel. See, ChatGPT or Gemini or whatever you say in different terms like generative AI, they cannot decide whether you should take treatment or you should not take treatment. What I want to convey to general public is that you should know where is the limitation of AI in current era.
Currently.
I am not at all against. I think none of us, my
No
colleagues,
one's
are
against.
but we, for general public, I think in medical world there should be a break at some stage.
But I just do want to mention another statistic that I read, that they say that a significant portion of users, almost 70%, trust AI a great deal to provide reliable health information. That's quite interesting. That's quite a high percentage that trusts AI. But like you said, it's all about giving the prompt, and if you're a lay person, you won't know the right questions to ask.
Correct.
And then now let's move on. I will talk to you about which symptoms you should take seriously and which are caused by stress and which are, misdiagnosed. We'll come to all that. But before that, again, another topic is excessive online searching, and the term is called Cyberchondria.
Yeah.
I just learned that term. And it's the psychological impact of excessive online searching.
Yes.
And people especially focus on the worst case scenario, or they catastrophize.
It is happening because it is free. It is instant. It is always there to gratify you. So the thing is, there is so much of luring effect to go to that. And see, if you see on psychological perspective, if you keep scrolling, the scrolling that somewhere makes you restless unknowingly, psychologically. Because you have not completed one video, but you have the right that you can scroll. Again you scroll, again you scroll. So it is a one-way conversation. And and people feel that it is replacing your friendship, and that is where everything is going wrong and haywire.
Yeah.
Because when you do excessive scrolling, you don't even know how many hours pass by. Sometimes my patient says that, Madam, my capacity of work has come down. So restlessness, inattention, anxiety,
Yeah.
early sleeplessness, and because of sleeplessness, again that circle of anxiety, restlessness. So basically, unfortunately, our young generation is going into a loop of this. I'll tell you one story. I had one patient. The mother got conceived after 10 years through IVF, such a precious pregnancy, and she came to me saying that my child doesn't speak Hindi or English. She speaks Chinese and Japanese. No, I'm telling you, I was so worried. I said, how come? This is the fact I'm telling you.
Yeah,
And
yeah.
they told that actually she loves cartoon, which is been spoken in Japan.
Chinese and Japanese
Yeah.
cartoon. And you know,
Yes.
make it ADHD is one thing, but even OCD, obsessive compulsive disorder, all these things can
Get
develop, you know. And then what happens is sometimes people are, you know, searching so much on Google, they're starting to mistrust their doctor.
Yeah, because sometimes we are very straightforward. We cannot be so lovey-dovey like ChatGPT. I think we have to learn from these all generative AI to talk more soft. I think that is what I will take message from this.
So let's come to now stress, how stress can imitate neurological disorders, okay? Which are the most commonly misdiagnosed neurological disorders?
It's a both way round.
Yeah.
Like if you are too much stressed, then I see many ladies, especially females, I'm saying, because you know they come with more of the
stress.
non-specific neurological symptoms.
Okay.
So they said, I have giddiness, I have headache, I cannot concentrate, I cannot sleep, I have some tingling sensations in my body, I have tingling sensation in half of my face, I sometimes feel blurry of the vision. See, as a doctor, I just can't say, oh, you are female, you are stressed, means all these symptoms are due to stress. I don't. So as a neurologist, it's my hardcore duty that I do some relevant test to prove that it is not so. And then I feel that stress can cause anything. I'll tell you again one grave story. I had one patient when I was in Bangalore. So the lady didn't get up from the bed from last 5 years. She had a bad sore. And she came to my institute where I was I was there, and then we did all the tests, MRI, NCV, and we found everything is so normal. And then when we took the detailed counseling, we found that she could not adjust with the in-laws, and her leg. Now it doesn't mean that she is malingering. It is a psychological distress. Similarly, I had one patient who came from Uttarakhand to me. Still, the boy is under my follow-up. So first he had a severe headache, looks like occipital neuralgia. I gave Botox and within 1 day he improved. He went back and then he came again saying that he cannot walk and he cannot use one of his hands. Now his father is not from such a rich family, but still he took train and all and he came. And as he entered my room, now see, after seeing four patients for so many years, I could just make out that, but then I have to prove it. Then when I saw, I understood something is really wrong now psychologically. So I called my psychologist and I told, see, Megha, you need to do something. And then when she took the detailed history, we understood he was getting bullied in school and he could not take it. So stress can cause anything. Means you can't even imagine. It is only just as a doctor, like because we are continuously seeing patients, we can differentiate. Otherwise, I don't think as a non-medico, I would have ever been able to differentiate. And sometimes it is so difficult. I have to do tests to even make myself understand that it's psychological.
But these are very serious cases you're talking about.
Yes.
You know,
but they exist.
These are very serious symptoms.
Yes.
ये लक्षण बहुत ही serious है, बहुत ही भयंकर है. You know, they're scary symptoms.
Now, if there is already a neurological problem and you have stress above it, then that neurological condition itself can get worsened.
Yes.
Like if you have Parkinson and you get stress, the tremor increases in the hand. So they come saying that, Madam, Parkinson bhar gaya. And I tell them, no, he didn't sleep at night or he is so stressed out, so he temporarily bhara hai. So, you know, stress can increase migraine tendencies, frequencies. Stress can also worsen already underlying neurological complaints. So it is a both way.
Manifest as neurological disorders,
which it is not. Yes.
You know, शारीरिक बीमारी नहीं है, it's
Yes.
like मानसिक है, you know, it's
Yes.
all in the mind.
Yes.
Can stress cause neurological disorders?
So it can be via. Like
Okay.
as I told you, stress directly is one of the risk factor for causing increase in migraine.
Yeah.
It can, if you have stress, it ultimately leads to uncontrolled diabetes and hypertension.
Yeah.
Because there's adrenaline rush in the body.
Huh.
Now this uncontrolled hypertension and diabetes will lead to stroke.
Coming back to these patients who you said, the boy from Uttarakhand and the other woman in Bangalore.
Yeah.
So you realized it was just stress. So then how did you, अपने इलाज कैसे क्या किया?
Counseling, I tell you, when you counsel, there are so many behavioral therapy and counseling. It works wonderful.
And they got cured.
They get cured. They walk and go.
That boy was fine then.
That boy walked and
And the woman?
No, because it was deep rooted.
Very deep.
It actually we have to see. See, I tell you, there lies the importance. As you told, you were asking me, are you Raj Yoga trainer? I said there lies the importance of meditation, relaxation, learning the art of living.
I want to come to that you are a Raj Yoga trainer and about, you know, a holistic approach, you know, that deals with the mind and the body.
Yes.
But coming to headache as a symptom, tension versus serious headaches.
Yes.
Okay. So often, you know, and when people have aneurysms and all, one of the main symptoms is a bad headache, right? And blurry vision and things like that. And maybe a little bit of unsteadiness or losing consciousness and things like that. So how do you differentiate between a tension headache and a serious headache?
I'll start answering it as the patient enters my OPD. So if my patient says that, Madam, I have this kind of headache from last 15 years, 10 years, 5 years. It comes and goes, I am more interested in finding out what is the trigger this time. They are mostly tension type headache. I don't even ask them for imaging. I ask them their lifestyle, their dietary function, how much they are exposed to sunlight, and that looks to me a primary headache where I am not much concerned about. Yes, I always give them reassurance. I give them medicines. It needs to be treated for no doubt. But then I am not worried as a doctor sitting on the other side of the table that I have to jump from my table and give them warnings.
Okay, fine.
So now another comes the secondary headaches. These are tough headaches. See, they normally present with something which is bizarre. Like either they said that I never had headache in my life, madam, but then certainly from last 5 days it is the worst headache of my life. Now then I'm worried. Then my ears and eyes are wide open. If they say that I'm having continuous multiple episodes of vomiting, or I had episode of loss of consciousness, or I have some ringing tendencies in my ear, or my vision has got blurred, or my hands are not, like it looks like it has gone weak, then all these are some red flags and I can't ignore. If the headache is associated with fever, I can't ignore. If they have some neurological testing, they find out some tightness and all, I'm very serious.
Then it's meningitis usually with fever?
This is what I'm talking about. It's not, every fever can present with headache. Every fever with headache is not meningitis. So again I say there is a difference, but then we do some examination, we ask them to do their neck and they find some pain, means there is meningeal irritation, and then I get the clue that okay, this can be meningitis, I have to take care of this. Like that. So this way I take care. Again I say, if a boy come to me with headache, then I am little skeptical, because migraine is mainly, it also has some role with hormonal changes. So normally females have, but if male comes to me, I say no. Let me have a look with one
How
MRI.
interesting. So women are more because of hormonal changes, menopause, perimenopause, they get headaches.
And that entire 28 days of their menstrual cycle, they have sometimes follicular phase and luteal phase, sometimes this hormone is high, sometimes that hormone is high.
Period headaches and all that. Of course, but men, then it's a red flag. So either it could be meningitis. When do you feel, sometimes it can be aneurysm also, right?
As you told about aneurysm, I'll give you a story. Currently that patient is still admitted in my hospital. So he is a shopkeeper to a very big shop in some close by. So his family, he came to emergency when I was there looking another patient, and I was told, Madam, we have one very young person who has come with sudden onset loss of consciousness. And then I went, and the wife was standing next, worried, tensed, and I asked, what happened? Because we don't know, ma'am. From last 10 days, he was having headache. And then he thought it is just a general headache. He went to one just doctor, paracetamol. He just took paracetamol. And then today morning, he collapsed. And then when we did CT scan, we found that there was an aneurysm sitting. He's still there with us. We are planning to discharge by God's grace.
But is he conscious?
Now he is walking, talking.
Wow.
Yeah, so the thing is that he had aneurysmal bleed. Yesterday only we got him. He went to coma. He came out of coma. Now thinking it to be migraine and losing that 10 days was a grave mistake. But again I say they were laymen. They don't know medical.
They lost
I
10
can't
days.
I can't blame them. But it just happened.
But he did go to a doctor who gave him paracetamol, right?
That.
No, anyway, whatever. Won't get into that. But so red flags are often when it's a male with a bad migraine, or when it's a headache, when it's someone who's not used to getting headaches but has got a bad headache. Little bit of vomiting, losing consciousness. What about blurry vision? Is that also an aneurysm symptom?
Yes, it depends. See, aneurysm can be in the anterior part of the brain, posterior part of the brain, near the ophthalmic nerve or anything. So if it is pressing the nearby structure, you can have some structural deficit along with it. Depends on कहाँ से आ रहा है वो aneurysm. कई बार वो aneurysm बिना फटे ही problem create करता है, क्योंकि depends कि वो है किधर. आगे की तरफ, पीछे की तरफ, आंखों का जो नर्व है उसके क्लोज बाय बैठा है तो वो नर्व्स को दबा रहा है, तो उसको सिम्टम्स आ रहे होंगे. सो इट्स लाइक दैट. सो
what's the survival rate usually with aneurysms? So how many cases get very serious?
See, it all depends. Aneurysm छोटी है, बड़ी है, whether it is small, big. If it is small, the tendency of bleeding is very less. If it is anterior, the chance of bleed is less. If it is posterior or it is large, then the chance is more. I tell you, in last 3 months, I got 2 aneurysmal bleed, even involved, including this case. So both of them had a love for gym.
Oh, interesting.
So now I am not generalizing it, but then I am just telling it happened. So both the boys, young boys, both had a love for gym, goes invariably to gym. Now what happens, aneurysm, there is already these vessels which are not doing that great, not healthy. So now when you dumbbell, when you so there is a sudden rise in intracranial pressure and it just give away and there is a bleed.
So too much gymming is not advisable.
For people who have aneurysm, but I tell
you, how do they know if they have an aneurysm? Yeah, but that's interesting that the 2 cases you've seen are avid gym goers. That's very important to note. What is a golden period like within which you should detect it and take treatment for an aneurysm? You said this person.
There's no golden period per se. See, I tell you, aneurysms are mainly asymptomatic. You don't even know it's sitting in your brain till it create havoc. Or sometimes just because of no reason you are just going and saying, चलो एक MRI करा लेते हैं, हल्का हल्का दर्द होता है. It is just incidental many a time. But if I have to give preventive measures to people, good preventive measures, stop smoking.
Stop smoking.
Yes, that's the main
thing. One.
And if you have cholesterol, correct the cholesterol, because atherosclerotic changes that happen secondary to high cholesterol for years can also lead to aneurysms.
High cholesterol, plaque buildup.
Yeah. So these two is something that I would say कि यही कर सकते हो, but aneurysm is not very common, so don't worry.
You had mentioned meningitis earlier. Like, what is like the survival rate of meningitis?
Too good. I don't think any of my meningitis patient has succumbed.
Okay, good. That's good to know.
It's treatable, no?
Chronic fatigue can be a symptom of MS, multiple sclerosis, but sometimes people again miss, like you already said about this woman who misdiagnosed it. So when should you be worried? I mean, about fatigue and sleep disturbances?
See, I tell you, fatigue can be a very common, normal, without any association with any disease. You are in the premenstrual phase, you might get fatigue. Someone scolded you, you cried. After 1 hour, you might get fatigue. In MS, there is a huge list of, like I tell you about my residency when I used to read about MS. There's a huge list of symptoms. ये और कहीं कोने में जाकर नीचे fatigue है. Now, if you take that fatigue as the primary symptom of MS, I think I should laugh it out. Not the primary symptoms. Patient says, मुझे अचानक से दिख नहीं रहा now. That can make me feel considering it as a. So it's not.
But just to establish here, to mention here that MS is an autoimmune condition.
Yes.
and it affects the central nervous system. So
Absolutely.
basically your body and your brain's communication breaks down because that protective layer around the nerve fiber is affected.
Yes, it's a demyelinating disorder. So when I have to teach general public in a very common language, I tell them कि रास्ते के बाहर जो वायर दिखती है, इलेक्ट्रिक वायर, उसके ऊपर में ब्लैक कोटिंग होती है ना, तो वैसे ही हमारी जो ब्रेन है वो पूरी वायर की गट्ठी है. इट्स अ bunch of all these electric wires which is covered by a coating which is known as myelin. So when that myelin get disrupted, it leads to a condition which is known as demyelinating disorder. And among those demyelinating disorder, we have one neurological disorder which is known as MS. Just one funny incident I'll tell you. I had one lady who came with, as you said, fatigue and sleep disturbance. And she didn't have periods for 2 months. She was pregnant.
She was pregnant. But I'm surprised she didn't think of that like before coming to you.
But she thought of something
She thought of
else.
MS.
No, something else.
Oh, she thought of something else. Okay. Yes. But I mean, I know we spoke about aneurysms, but just to briefly go back and describe, an aneurysm is a bulge in the blood vessel of the brain.
Correct.
And when it ruptures, that's when it's dangerous.
Yes.
It happens often when the artery walls thin down.
Yes, artery walls is diseased. Sometimes it can be genetic.
Yeah. Okay.
There can be genetic. There's a Marfan syndrome, Ehlers-Danlos syndrome, where the connective tissue that is responsible for creating the coating of the blood vessels are not very healthy because of some changes in the structural pattern of the muscles of the vessels. So they are inherently weak. It can be genetic, definitely. Genetic, alcohol, smoking, and this cholesterol and all, as I told you.
Coming to stroke, you're a stroke specialist.
Yeah.
When someone walks into your office and they feel numbness or tingling, can't move one side, what tests do you run? What do you make them do, to ascertain whether it's a stroke or just anxiety?
See, I tell you, they give a very peculiar history. I have seen stroke patient had stroke yesterday and came walking to me after taking proper appointment because they don't know it's a stroke.
Oh.
So they enter my room. As you keep asking me, I remember my patient.
Very good.
So just 2 weeks back, I had a patient who came to me saying that, Madam, I just came to visit you because from yesterday my voice it's not clear. It's not clear. And I said, see, it looks to me a stroke. And he said, really? But I'm walking, you see, my hands are good, my legs are good. I said, stroke is something beyond your hand and leg. And then I sent him to emergency. We had a cord white, and cord white is something where priority is given to a patient who is suspected to be a stroke.
Cord white, yeah.
And we got the MRI done, and he had a stroke, very small stroke. Obviously small, that's why he's walking, talking patient to me. Now, with that stroke, the thing was that he had a 90% blockage in a major vessel. So it was like a warning stroke to him. And if he would have blocked 100%, he would have got massive stroke. So we admitted him, we put the stenting, and he went walking, laughing, and he said, ma'am, I think you saved my life. Stroke can come with just slurring. Yeah. Stroke can come with one hand weakness or both hand weakness. Stroke can come with sudden onset blindness.
Okay.
Yeah, because our brain our eyes,
optic nerves,
our vision center is in the back of the head. So when you get stroke there, patient will walk and talk, but say I cannot see. So there are patients who stops talking. So that is known as Broca's aphasia. So there is one patient who started using all irrelevant words. And the family member thought it is, मेरे पापा पागल हो गए अचानक से कल से. And then when we saw, it was a Wernicke's aphasia, which is also a kind of stroke. So I don't want to terrify my people, but all I want to give message is that any symptom which is sudden onset should be first considered as stroke until proven otherwise.
So what is the golden period for a stroke?
Golden period in what form? Like thrombolysis that we do?
Yeah.
We give some injections which revert back the stroke.
Golden period for actually reversing the damage.
Yes, that is ideally considered as 4.5 hours. There are some cases where I have done thrombolysis at 9th hour also.
You can explain thrombolysis.
So thrombolysis is basically a kind of injection which was not available 5 years down the lane. And whenever a patient of stroke used to come, I used to say, I'm sorry sir, you have a stroke. महीना लगेगा ठीक होने में, फिजियोथेरेपी कराते रहो, टैबलेट खा लो. But now the world has changed. नाउ वी से आपको स्ट्रोक है, जल्दी आओ। 4.5 घंटे के भीतर हमारे पास एक आईवी थ्रोम्बोलाइसिस होता है, जो दो ड्रग्स होते हैं, एल्टेप्लेस, टेनेक्टेप्लेस। अपन जब हम उस टैबलेट को देते हैं तो जो ब्लॉक आया है ना इन द ब्लड वेसल्स, वी लिक्विफाई इट एंड reinitiate the flow of the blood to that brain. So somewhere we can save that brain from dying and preventing further permanent deficit.
So this is a newer injection.
Newer means I am using it from last 4 years.
What about things like, do you ask patients to like smile when they walk in? If a smile is crooked, then it means it could be facial paralysis and a stroke,
yes.
things like that. Yeah.
I think you have done lots of research.
No, I mean, I know a lot of doctors too.
But absolutely
and I have
correct.
family members who had strokes, luckily
Yeah.
they're touch wood, they're fine. But what about aspirin? Because a lot of people give aspirin thinking it's a heart attack maybe, and that thins the blood, and that can be worse for a stroke.
Correct.
That's caused by bleeding.
Stroke is a neurological emergency.
Yeah.
So when you have a stroke, there can be two type of stroke.
Yeah.
Either there is decreased flow of blood to a particular organ because the vessel got blocked. So one is vessel blocked and you got a stroke, and another is the vessel got ruptured and there is a bleed and you got a stroke.
Okay.
Both of them almost present with similar symptoms. Weakness of one side, or cannot talk, or your eyes went to one side. Similar symptoms. Now sitting at home, you found that okay, the patient has, I suspect it's a stroke, and you gave aspirin. Aspirin is a blood thinner.
Yeah.
It might be great if it would have been a
block. Right.
But if it's a hemorrhage, which you will never know without doing imaging, and you pop up aspirin, I tell you, my heartbeat increases. If the patient can be shifted to ward, I shift this patient to ICU. Bhai, ye bleed na maar de. If the bleed may not increase, must not increase.
Very important to know all this.
Sometimes the stroke comes because of cardiac abnormalities which patient doesn't even know.
A blockage?
No. There is the conduction defect, especially atrial fibrillation करके एक होता है जिसमें दिल अजीब से मारता है. It is not so उससे होता है. कई बार क्या होता है?
Atrial fibrillation.
Yes. और कई बार क्या होता है, दिल के अंदर एक खून का क्लॉट बना हुआ रहता है जो फट के ऊपर जाता है और स्ट्रोक करता है.
You've also talked about Parkinson's, and about memory, because you're a memory specialist. Sometimes people think that they misconstrue or misdiagnose Parkinson's as depression.
Yes.
And they treat the patient for depression.
Yes. See, Parkinson is a neurodegenerative condition जिसमें केमिकल होता है ब्रेन में जिसको बोलते हैं डोपामिन.
हाँ.
उसकी कमी बनती है. डोपामिन इज अ हैप्पी हार्मोन, इट्स अ रिवार्डिंग हार्मोन. तो जब डोपामिन कम होता है ना, तो पेशेंट के कुछ लक्षण आते हैं. लाइक पेशेंट बिकम स्लो, दे बिकम वेरी स्लो, दे स्टार्ट वॉकिंग विद देयर bending forward, their arm swings come down, they cannot control urine, they have unusual pain in the body. उनके चेहरे का एक्सप्रेशन खत्म हो जाता है. Now प्रॉब्लम क्या होता है कि जो घर वालों जिसमें मेडिकल फील्ड का इतना नॉलेज नहीं है, उनको ये लगता है दिस इज ऑल एज रिलेटेड, एंड समटाइम दे ignore it to such an extent because there is stiffness all over the body because of Parkinson, जिसके वजह से joint में continuous stiffness के वजह से joint खराब हो जाते हैं पेशेंट के. They start developing knee osteoarthritis which was not there. They start developing lumbar spondylosis, disc problem which was not there. But they are misdiagnosed. They are never diagnosed as Parkinson. So they go to orthopedician, they get knee replacement. They go to spine surgeon, they get one disc laminectomy surgery done. But somehow by God's grace, sometimes they land up to my OPD and I say, oh no, you had Parkinson.
Oh gosh.
So and their facial expression comes down, because of which they look very depressive.
So, but Parkinson, does it also eventually lead to memory loss and dementia or not?
No,
not
they are not related.
They're not related at all.
Totally different.
Totally.
As you said, I am specialized in two. One I did in Parkinson, another I did in memory. So they are totally two different, but there are certain genetic predisposition जहाँ पे Parkinson भी दिखता है, memory loss भी दिखता है.
अच्छा.
But they are totally different.
Totally different.
Yeah. One of the non-motor symptom of Parkinson comes as mild memory, but not full-fledged memory loss, like we see in classical dementias.
I want to come to, another interesting element about you is that you're a Raja Yoga teacher.
Yes.
So you take a more holistic mind-body view to health, I'm imagining.
Yes. I think I'm lucky enough. I started meditating from 2005 and from 2017 I'm a trainer. So as my medical world started in my life, sidewise my spiritual life was also going on. Sometimes when I tell my friends about these Raj Yogas and all, they laugh at me and they say that, see, Dr. Sheetal, you are being a science student, what are you talking about? But I personally feel they are both like two wheels of a car, two sides. And if you take both the wheels together, no, you can fly high. This is what I feel, because they are very much related to each other. Spirituality is all about science.
Absolutely. You said it absolutely correctly. Most of the great scientists of the world were very spiritual people.
Correct.
You know, so आध्यात्मिक लोग भी थे, you know, they've also deeply spiritual.
In fact, जब हमारा Nalanda University था, I don't know too much about history, but then, you know, they always spiritually binded and then they were taught science.
Yeah.
So I strongly feel that this spiritual life has made me a better doctor than what I would have been if this spiritual world would have not been added to my life.
Wow, that's lovely. But I do want to ask one yoga related question about headstands, Shirshasana. Okay, because neurologists have told me that headstands, don't do headstands. It's not good for you. What's your view on this?
There are multiple asanas. Among that, one is what you're talking about. See, Sirsana is not for everyone.
Okay.
Because, you know, those who have asymptomatic aneurysm and BP, it's strongly contraindicated. Because when you do Sirsana, that is the most lowest part of your body that time.
Right.
And, you know, it increases the blood flow in that part of the body. And if it is hypertensive, then the vessels might rupture. If it is aneurysm with high flow, it will rupture. Let it be with the very, very trained people, because I'm really afraid on telling my patient you can go for it.
And definitely if you have high blood pressure, you should not do headstands.
Definitely not. It's a contraindication.
Okay. Lastly, doctor, can you give us some easy everyday tips for good brain health?
Everyone says, I think your grandmother also says, sleep well, sleep healthy, sleep with lots of positive attitude and be very thankful to God. Whether you believe it or not, if you don't believe in God, be thankful to divine power that today you are in bed, sound and calm. And this is about sleep. Then I also focus on proper hydration. Eat balanced diet. It doesn't mean that to a youngster I'll say don't have noodles. You can have it again with moderation. Adopt some behavior like relaxation, meditation, something in your life that when something really goes haywire, you have someone to look up to.
Wonderful tips. Thank you. Most of them were spiritual tips. I love that. Thank you so much, Dr. Sheetal Goyal, for joining us on Buzz Bite.
Thank you so much.